You are about to watch a simulation video of Unit 2. This unit is about understanding spiritual interventions and resources at end-of-life care.
Bye. Hey, Shauna, sorry. Hey, great to see you.
Good to see you.
Yeah, tell us, can I talk to you about a patient when you get the chance?
Yeah, have you time now?
Oh, brilliant.
Do you
Yeah,
wanna go
that's
to my
great.
office?
Yeah, brilliant.
Brilliant.
Yeah, great.
Right.
So Mary Murphy has been admitted and she's been diagnosed with cancer. Now it's likely that she has some metastases. Her son, John, he has a history of mental health issues and she's very worried about John. Now she has an idea of what's going on, but what do you think?
See, it sounds like Mary's not just worried about her own health at the moment, but is even more so worried about John.
Well, that's what I was thinking, because when she goes in for treatment, after she doesn't complain of any pain, and I believe we need to look into John and on a deeper level.
I do think you're picking up on something there. While she might not have any physical pain at the moment, she may have other pain and a psychological pain. So because she's worried about John and, you know, the pain of losing him and what's going to happen to him in his future, maybe it'd be worth talking to her about what's meaningful in her life.
Okay, I've seen that her faith has been shaken because she's seen John so unwell. I think we need to look into this on a deeper level.
It's, you know, important to explore Mary's spiritual needs at the moment, you know, what's important for her, what does give her meaning in her life. And I also think it's important to explore, you know, what her wishes are as her condition deteriorates.
Yeah, and can you take care of that?
Yeah, I can help, but I think Mary has, you know, had made a relationship with you and had these conversations with you, so it'd be really, really good for you to continue working with Mary and having these conversations, but I can definitely link in at a further time.
Yeah, and you can give me a hand if I need to, yeah.
Yeah, absolutely, no trouble at all.
It's brilliant, yeah, that's great.
My name is Shauna Sweeney and I am a healthcare chaplain. I work in palliative care, but I have worked previously as a healthcare chaplain in psychiatry and in an acute setting. Healthcare chaplains can work all over healthcare in Ireland, and our role is we provide spiritual, emotional and relational support to our patients, our families and our staff that access the service. And I suppose when you think of, you know, a chaplain, you automatically probably think of a priest. Obviously, it's not the case all the time because I'm a young lay chaplain. It's really important in a palliative care setting and all healthcare settings to be able to have conversations with the patients and their families about what's going on for them. As a chaplain, it's my responsibility to explore the spirituality with the patient, their meaning, their purpose. Sometimes, you know, patients can have existential crisis and pain, and we use spiritual assessments to assess what the needs are for the patient and where we can go with them and the supports that we can give them. I am part of the MDT, the multidisciplinary team here in the hospice, and we are a member of the team like everybody else. I suppose we have a unique role because we can support staff and nurses and doctors and physios and occupational therapists to discuss some of the conversations that they have with the patients, because they might not know how to approach some of the topics that the patient brings up. And I suppose the scene that you just witnessed is a really good example of that. You know, a nurse struggling to kind of delve deeper into what the spiritual pain of this lady was, and I was there to support and offer a bit of advice and guidance on how they can kind of deepen those conversations and get to that real pain that she's experiencing, and to hopefully have a good encounter with her and help her along her journey. It's such a unique job and there's so many elements to it that, you know, there's so much joy in all of it. It's not a joyous job because you're dealing with people's pain all the time, and that you see real difficulties that people have to go through and their struggles and their pain. But through that, I get my sense of purpose and my sense of, you know, that I'm helping somebody and I'm supporting them, even though I'm not attending to their physical needs, or I can't fix something or fix their pain or help them. I come away feeling that I have been on that journey with them. And it's something that, it's a feeling, it's a buzz. I can't explain it very well, but you feel like you're helping and supporting somebody. And that's my favourite part of the job. The role of a healthcare chaplain is to support the staff who can sometimes struggle with the more deeper, you know, questions that patients may have. And you can see that Adam was kind of struggling with some of the stuff that Mary was bringing. And, you know, when I asked him, you know, have you asked her about what's meaningful in her life? It gave him the time to reflect on, well, maybe I tipped it, but I didn't actually go deeper. And by going deeper, that could open up the conversation a little bit more. And, you know, it's my job as the chaplain to support staff to kind of bring that awareness to their experiences with the patients, because, you know, the nurse is not just there to attend to the physical needs of the patient or to give medication. You know, as we can see, Mary connected with Adam, but Adam just needed that little extra support to kind of guide Mary and to bring some of that stuff that she was struggling with out to the surface, so that then we can help her in that spiritual pain and distress. With Mary, I suppose Mary's big concern was John. And, you know, my role would also be to link in with John and to see how he's coping and how he's supporting. You know, if I have to link out with him, or I catch him when he's actually in visiting his mum, I would give, you know, time to John to see how he's coping, and then maybe bring him in to his mum and sit with them and see how they're doing together. You know, it can vary and differ how your interactions are with families and the patients, but a huge part of the job is to make sure families also feel supported and heard and listened to, because they are as distressed as the patient can be. The other side of it as well is that, okay, we are there to guide staff in these kind of deeper conversations with people and make them aware of the patient's spiritual distress and pain. But our staff can have similar things happen in their lives, and they can go through pain and struggles, and they might connect with a patient and really struggle when they deteriorate or are close to death or die. And, you know, our door is always open to help support staff in any area of their life, professionally or personally, and to just make sure that their self-care is in place, to just have that open door policy where they can come and have a conversation about whatever they're struggling with.